Hi, it's Dr. Elisha Van Duzen with New Hope Chiropractic with some important facts about carpal tunnel syndrome. Carpal tunnel syndrome, or CTS, occurs as the result of the median nerve in your wrist being trapped or squeezed as it's passing through the carpal tunnel, and that's located in the wrist. And there are 9 flexor tendons with their coverings or sheaths. Those are the tendons that flex your wrist like that when you make a fist, for example. And blood vessels, connective tissue, these things also pass through this area, and it creates a tight passageway between the forearm and the hand. Therefore, if you have swelling of your tendons and their sheaths, or leaking of the synovial or joint fluid, which is fluid around the joints, the bones, then or bone spurs, cysts, or swelling, inflammation of any kind, anything like that can put pressure on the median nerve and can cause carpal tunnel type symptoms. Anything that increases the pressure inside this tunnel can cause these symptoms. And what are the symptoms, you might ask? Well, there are numbness, tingling, feeling of your hand falling asleep, swelling, and a weak grip, like, for example, difficulty grasping things, unscrewing the lid from a jar, for example. Sleep interruptions are common with this type of condition too, especially if you bend your wrist at night, and that of course further increases the pressure in the soft tissues and makes the problem worse. And some people have a greater risk of developing CTS. For example, women are 3 times more likely than men to develop this condition because they inherently have a smaller tunnel in the wrist as well as a slightly different tunnel shape, so that can predispose them to this. And also, the following diseases or conditions can actually predispose somebody to having carpal tunnel syndrome, like diabetes, hypothyroidism, birth control pills, and other hormonal replacement therapies, pregnancy, and also some types of inflammatory arthritis will increase symptoms of carpal tunnel syndrome. Also, jobs that require fast, repetitive work without enough rest time, and those that require forceful gripping also increase your risk of getting CTS. And also ergonomic factors like certain job tasks, tool handle shape, body position, or working assembly line, for example. Sitting for long periods of time, especially when the head and neck are not in the normal position, and also work that requires telephone use where you're holding a telephone up to your side of your head like this on a regular basis without a headset, that also will predispose you to this problem. And we diagnose this due to a evaluation of the history, physical examination findings of the hands, arms, shoulders, and neck. And we do this because we want to make sure that it's really carpal tunnel syndrome and not something that's mimicking it, and something totally different. So we'll run a series of tests to differentiate between the many causes of CTS, and then we'll get a very good idea of what's causing it and if it really is carpal tunnel syndrome. Chiropractic treatment with carpal tunnel syndrome includes things like rest, ice, night splints, exercises, job modifications, workplace ergonomic instruction, but really the unique feature that separates chiropractic from medical-based non-surgical care is the use of manual adjustments, specific adjustments applied not only to the forearm but also the wrist, hand, and also very frequently to the elbow, shoulder, and neck, as these areas very, very frequently and commonly contribute to the symptoms and should be managed for and addressed if you're going to have a successful outcome. So anyway, if you know anybody or you yourself have carpal tunnel syndrome, any of the symptoms that I just outlined for you, it would definitely behoove you to come get checked out, see a chiropractor, get an evaluation, and then we can take the next step and get you cured. You can check us out at newhopechiropractic.com, or you can even make an appointment as well to get evaluated, and we'll be happy to check you and get you on the road to better health. So hope this helps, and with this, have a very healthy day.